The surgical unit at Stracathro within NHS Tayside is an elective surgery unit where we perform day case and short stay surgery under various specialities, which are orthopaedics, general surgery, urology and plastic surgery. We take patients from NHS Tayside but also from NHS Grampian and from NHS Fife as well. Certain procedures that we perform here require patients to have cross-match blood available. So the bigger operations like hip replacements, knee replacements, laparoscopic surgery, etc. So when the patients are pre-assessed, they have a first sample of blood taken for group and screen. But before they come in, they have to have a second sample taken, a cross-match sample. If the patient requires a transfusion while they're here, we can access blood in a specialised blood storage facility called the Hemosafe, which has an IT link to blood transfusion at Ninewells, and we can access this blood if required. But to access this, it's imperative that the patient has the second sample taken before they come in. The anaesthetist, who is the lead anaesthetist for pre-assessment, had heard about Florence at a meeting that she was at and thought it might be good for us to use at Stracathro, given that although patients are informed that they will need a second sample taken, many of them forget about this, and we each week have to phone quite a few patients. It varies between about 4 and 10 to remind them to have the second sample taken. We're hoping that Florence will save us a significant amount of time. At the moment we identify patients that require transfusion support and check on a system called Blood Track Inquiry to see if the patient has had their sample taken and if blood's available. If not, we then phone the patient. Quite often we phone and there's no one in, so we have to try at various times of the day. And then when we do phone, we often find that the patient has several other questions not relating to the blood sample that they want to ask about fasting times and the time that they have to come in, etc. Although this information is all sent out to them. So what can, starts as a short phone call can end up being 10-15 minutes by the time the patient has asked several questions. So we're hoping that by sending the text that will cut down on that time, because the process of actually registering the patient on the Florence system takes a couple of minutes. It's a very short process. We had to liaise with the pre-assessment departments within NHS Tayside because they see the patient first and they have to gain the patient's consent for Florence to contact them. But they're been very helpful with that as well. At the moment, that's all we'll be using Florence for. This will be a test to see if it is effective. I believe that pre-assessment would like to use it for other prompts. Sometimes patients have to have stop certain medications before they come in for surgery. And I think that's maybe the next step. If this is seen to work for us, then that might be the next step to try that.